we have lots to cover. So let's get started with some introductions, and welcome to the ALZ Talks, everyone. So my name is Janice, and my mom, Grace, she was diagnosed in 2007 with Alzheimer's disease. And at that time, my mom and dad were living in Texas, and I live in Washington State. Now, I do have 3 siblings, but we were spread across the entire of the US. No one lived near my parents. So I watched my dad struggle as my mom's caregiver. Caregiving is just such hard work. And my dad had advancing heart disease, but despite that, he was really determined to give my mom good care. And so I did as many visits to see them as I could. I even took a 3-month leave of absence so that I could learn about the disease and I could help my mom and dad. Sadly, in 2010, my dad passed. And by that point, my mom already needed 24-hour care. So about a week, within probably a week, I had my mom move to Washington State. And then I had the honor to be her care partner for the last 3 years of life. So Kim, what's your story?
Well, Janice, I live in Pennsylvania and my mom was local to me. So I was in the same area as her, which was great. She was diagnosed with mild cognitive impairment, actually through a geriatric assessment that she initiated because she was feeling uncomfortable about some memory challenges that she was having. So it started that way. She had a fender bender in her car a few years later, and the doctor took her license away. And that was really my wake-up call to realize that I was going to have to start to take a more active role in monitoring what she's doing, her daily activities and so forth. So I'm an only child. And so it was a lonely experience in the beginning, trying to work through everything, especially in the early stages. But I was able to, work through it with help. Mom spent about 11 years in care facilities, starting with independent living, then memory care, and then ultimately a nursing home when her money ran out. Mom passed away in the nursing home last August after living with Alzheimer's for about 13 years.
Oh, wow, Kim, thank you for sharing that. The loss of your mom is so recent. I'm really sorry to hear about that. And, that was a long journey. Alzheimer's and other progressive dementia diseases, they're just so difficult, both for the people who have the disease as well as for their caregivers. As you just shared, 13 years, my mom had the disease for 7 years. So often it's a very long illness, and it's just so hard to watch our loved ones decline. So the disease really takes a toll, it takes a toll emotionally, physically, and also financially. And I think we don't realize how early in the disease that can happen, because often people who have Alzheimer's or other dementias, they're losing their ability to keep, track of numbers or money or how to pay bills. That happens quite early in the disease, and they may or may not realize that they're having that issue. So, Kim, how did this show up for your mom? How did you start having conversations about financial and legal issues?
Well, we had some brief conversations over the years, especially after her mild cognitive impairment diagnosis, but she didn't tell me much other than, everything's in a blue folder in a drawer. I couldn't get her past that point. And then once her license was taken, I started to push to see if she would give me more information. And she was resistant at first. She just was not willing to give up more information. And so I started to use what I call the empathy approach. And it wasn't something I came up with. Someone mentioned it to me as I was kind of trying to commiserate and figure out what I could do. And I utilized a process of saying, it'll help me if we get this information. If something happens and I don't have it, it'll cause me stress and just cause me issues. And she was such a compassionate person that it really helped her to come around to realizing that it would be helpful for me. And I would mention other stories that people had told me about situations they had where a loved one might not have given them information and how difficult it was. So that really, between those two types of stories, it really helped her to come around, and slowly she gave me information. We were able to talk through it. I made sure I had HIPAA forms filled out at her doctor's office, which I wasn't familiar with at the time, to make sure that I could get medical information, start going to doctor's appointments with her. And once she started to give me the information, we were able to actually go to an elder care lawyer who I had gotten referred to by someone in my Alzheimer's caregiver support group. So that was very helpful in pulling everything together and helping me understand what I needed. At that time, she was very much able to participate in developing these documents. And I was so glad to have them, especially things like, healthcare directives, so that I knew what she would want as time went on. So once I was able to get her to start to participate, I was able to start getting information on her bills, start to set up billing online, start to have her mail coming to me. And so this all tried to help, tried to do this all in small chunks, because it was difficult and overwhelming to do it all at once. So we would take a little step at a time. It might be one bill one day, it might be another bill another day. So over time, we were able to pull it together. It was not instantaneous. So yeah. Janice, how about your mom? Did you need to get legal documents in place for her?
Well, my situation was a little bit different from yours, because my dad cared for my mom in the early stages of the disease. So he kind of more naturally took on all that financial management. So my mom and dad, they already had all their legal documents in place. But we did have lots of discussions about those documents, about their preferences for care and for end of life, and also about their financial accounts. I mean, all these are such difficult discussions to have, but so essential. And, my dad, he worked in a financial field, so he was a pretty organized guy. I was fortunate that way. But sadly, I think, he knew his time was getting short, and, his heart just wasn't really working well enough. So, I can see now that he was just really beginning to prep me to become my mom's caregiver. And, a takeaway from that is just how important it is to have a backup plan, because you just don't know. I mean, you don't know if something will happen to the caregiver. And so that was a learning. I had a lot of other learnings as I went through this. I mean, one thing was just how state specific so many things are. So for example, my folks had all their legal documents drawn up in Texas. When my mom moved to Washington, one of the first things I did was to take her documents to a local attorney here. And I found out that her documents were very well written and they were actually valid in Washington. But I also learned that there were many other things like medical insurance or subsidy programs and Medicaid that are all very state specific. I quickly learned how important that power of attorney document was to enable me to care for my mom. I use that all the time. I mean, everywhere we went, my mom couldn't sign her name. So if there had to be a signature, I had to show that power of attorney form. So I learned, it's really important to read that document carefully and understand what it says. And I found that, legal forms can be found online. So it's not always necessary to engage an attorney. So many learnings when my mom first came to move by me. And, Kim, in your introduction, you mentioned that you had to move your mom multiple times. Can you tell me a little bit more? I mean, how did that go for you? How did you balance the care needs with all the financial constraints?
Well, it definitely was a challenge. By the time the mild cognitive impairment was diagnosed, we had about maybe 3 years before it became clear with the not driving that she
Yeah.
needed to have a little bit more monitoring. So I started looking at independent care facilities, and just luckily we were able to find one in the community where our church was. And my mom was very active in church, and that was really her primary source of social activity, especially once she wasn't able to drive anymore. So we were lucky to be able to find a place that was within walking distance of the church and that she could afford with her income. This is when I really started to become aware of the cost, because clearly the cost was doubled at least what her expenses were at the time in her apartment. So she was able to afford the independent care with just her income. And then as time went on and her condition started to decline, I realized she needed secure memory care. And then I saw how much that was going to cost, and she was not going to be able to afford it with her income, and she was going to have to start going into her savings. She did not have long-term care insurance. She had canceled it several years back because she didn't want to pay the premiums. And so we didn't have that as a resource. So I was able to move her to a memory care facility, recognizing I had to closely monitor all of her money because we were going to have to start using savings. I also started to subsidize with my own money where I could to help lengthen the time that her funds would cover the cost. So we did that for about 3.5 years before her money started to run out. And I had to then go to look in the Medicaid process, utilize the Office of Aging within Pennsylvania. And I know they're across the country to try to see what the options were. So for Pennsylvania, Medicaid required that she be in a nursing facility to pay. So I had to then start looking at nursing homes, which was probably the most difficult part of the process, and eventually had to move her to a nursing facility. And she ended up staying there for about 1.5 years before she passed away.
Wow. That is a complex, a long, and a difficult journey that you had to navigate. And, moving and transitions are so difficult for people who have Alzheimer's or other progressive dementia. So I can only imagine how hard that was for you, and, and doing it on your own too. So it's a brave story. One other thing that I think is increasingly an issue right now, and it's an issue for all seniors, but especially for those with dementia, is the issue of fraud. Did you take actions to reduce the chances of fraud throughout that time?
I did, and I wasn't necessarily thinking of it as fraud at the time, but it was just a part of the process I was going through, which was to put as many bills as possible on auto pay. So that stopped physical bills from going to the house. It stopped my mom from continuing to try to do things. It sort of slowly got her out of the process. I had gotten the physical mail to start coming to my home. So I changed address on everything. So that stopped any random people from being able to see her mail or do anything with her accounts. And I also froze her credit report, which I wasn't aware of before, which would stop people from going in and it would stop inquiries to be able to set up new accounts under her name.
Yeah.
So those are a few of the things that I was able to do.
Those are some great ideas. So if looking back, what are the things you wish you'd known sooner?
The thing I think about with that journey, as well as in my life in general, is you don't know what you don't know. And I didn't realize at the time what I was in for. And I think that to have done a little bit more research on Alzheimer's, the disease itself, the impact, the financials, the emotional toll, the support system that you would need, I would have clearly joined the Alzheimer's Association support group much sooner, because they were a lifeline to me, not only for resource information, but emotional support, not only from the facilitator, but the members of the group, who then can empathize because they're going through the same things you're going through. And just the support was unbelievable. Also would have engaged the elder care lawyer, or to your point, would have looked into more of the legal aspects sooner so that I wasn't reacting or dealing with everything in a very short time frame, I would have been more prepared. So I think those were the key things. So just gotten some more information sooner and been more proactively prepared for some of the things that I could possibly encounter.
Yeah. You know, the Alzheimer's Association has a saying of no one should face this disease alone. And that's really, you know, a lot of what you expressed, right? Because it takes a village, you know, it's such a difficult journey as a caregiver. And so we need, the best thing we can do, I think, is really to know our loved ones as well as possible, and then learn as much as we can about the disease and caregiving. That enables us to be the best caregivers. So, you know, we've talked and covered a lot of ground today. And as we just kind of wrapped up there, there's so much to learn with this disease. So we encourage anyone who's out there, if you have a family member with Alzheimer's or another dementia, or you just want to learn more about the topic, or you're caregiving today, you know, there's so much information that's in our education programs from the Alzheimer's Association. So we have topics like understanding Alzheimer's and dementia. We have an education series that's all about living with Alzheimer's at each stage of the disease. And these kind of classes can be really helpful for planning future needs, for caring for your loved one. And then even more specifically, we have a class called Managing Money. And that's going to go into a lot more detail on all the topics that we talked about today. And that education program, it actually provides worksheets that can be really helpful with things like budgeting considerations, care costs, and how to get assistance with care costs, how to organize documents. All these kinds of programs are available on demand at alz.org/education. And another great resource is the association's Helpline. So the Helpline is a free service. It's available 24/7, and it offers confidential support and information for anyone who has any kind of questions about dementia or Alzheimer's. And they're always there. So you can connect with them at 1-800-272-3900. And if you're watching this today on YouTube, we've included links to each of those resources in the video description.